and welcome to From the Front Lines. And don't forget to subscribe to the icon that you see here on DataBaaz, which brings you stories and interviews from the front lines, in this case, with public health experts and specialists. So let's look at the story that we are talking about today. The number of cases, and using Mumbai city as an illustration because proportionately it has amongst the highest cases in the country, are of course rising. But within that lies an interesting story. The number of cases in high rises and buildings and societies is rising dramatically much more than slums or high density pockets of populations. So for instance, the number of cases went up by almost 86% in the last month in buildings, whereas there was only about a 0.3% rise in slums. The number of containment zones is of more than 8,000 in the city of Mumbai. Only 500 or so, or 550 or so, are actually in slums, whereas the population of the city is roughly divided 50-50 between slums and high rises and buildings. So the question is really, why is this happening? And what can this tell us about either the behavior of the disease or the virus, or the behavior of people and the manner in which maybe interactions lead to viruses jumping from one person to the other. So to discuss this, I'm joined by two specialists. The first, Dr. Lalit Kant, the former head of the Department of Epidemiology and Communicable Diseases at the Indian Council of Medical Research, and Dr. Shivkumar Utture, president of the Maharashtra Medical Council and an active practitioner, particularly in some of those areas where we've seen high cases in the past, but no longer. Thank you both for joining me. And Dr. Utture, let me go with you first. So why are we seeing this kind of, let's say, a disparity, if one were to call it that, between the cases in slums and in high rises?
Yeah, basically, as you said, is it because of the virus, or is it because of the basic way that the population is responding to the virus? Now, virus does not discriminate. You may be in the slums, or you may be in the high rises or societies, whatever. So the fault, I think, basically lies with the people, the outlook of the people. Plus, of course, another thing you have to take into consideration, because there was one study which was done in Mumbai, in the slums and in the high rises both, where they found that antibody studies were done. Almost 57, and this was about 1.5 months back. 57% of the people turned out to be positive in the slums, whereas on the high rises there was only around 17%. So maybe majority of the slum dwellers somehow or the other may have been infected in the past, and they have gained some immunity. So when we talk about 57% and 17%, that means almost in the high rises 63%. I mean 83% were nowhere near getting infected or anything. So just as you see that we had the peak which came to Mumbai first, whereas the rest, and especially the MMR region and all, were not much affected. But today we are seeing that the MMR region of Mumbai is much, much higher than Mumbai, because the peak has come in those areas. So similarly, I feel even now the peak is coming in the societal areas. Another aspect is, of course, it has been 6 months since the lockdown. People have been cooped up in their house for 6 months. We saw a lot of discipline in the initial phases in the high rises in the societies also. But slowly, somehow or the other, either people have stopped getting scared of the virus, or the boredom has set in to such an extent that a lot of these people are coming out and they are mingling, mixing. Unfortunately, I would say almost 30-35% of the people on the road in Mumbai today are not using the mask in spite of being told to use. So it is a combination of both these things that basically we are saying that it has gone up so much in the societies. And as far as the slum is concerned, yes, surprisingly, the discipline is there in the slum, along with, of course, a lot of patients who are already immune to the disease.
Right. Dr. Kant, how are you seeing this phenomenon? I'm sure that it's somewhat similar in Delhi and maybe in other places, though I've not looked at the numbers. I mean, in this case, I'm using Mumbai as an illustration.
Right. 22nd of March, exactly exactly 6 months ago. That was the day when we had observed the Janata curfew in the country. So we are now exactly 6 months from that point of time. And during that period, 6 months, enormous amount of the epidemic evolution has taken place. You know, whenever this, whenever this epidemic came, it was brought into India by people coming from abroad. That was the way how it started. And most of the people who were coming here, they were staying in better off places where you had, maybe in those maybe in places where you have high-rise buildings and all. So the infection started from there actually, and they gave the infection to the people who were there staying with them, houses there, their people, drivers, helpers, maids of the house. And these people were those people living in the slum areas. So the infection actually started from those high-rise places to those slum areas where we had where where we had where we had conditions which were very conducive for the spread of the infection. Now, over a period of time, when the infection had spread in those areas, those people, as was explained earlier, those people have developed, some kind of immunity. They have had, they have had infection prevalence. But the people living in those high-rise buildings, those were the places where we had strict lockdowns, and those people were not moving around, they were not mixing around. And now these health people are coming back, and as the economy is now is also opening up, these people living in those departments, no, people living in those apartments are now moving out, working out, and they are mixing with people and also bringing in the infection. So I think it's a kind of an evolution of the epidemic. And if you see anywhere in the world, it always starts in places where population density is much higher as compared to elsewhere. But ultimately, it goes to all areas, totally irrespective whether the density is high or density is low. So I think it's just a matter of the evolution of the epidemic.
And the sequence or the evolution. Dr. Utture, can I come back to you? So what are you seeing right now? I mean, for instance, I think the last time we spoke, we were also talking about the number of beds that were available. And you were saying that a lot of smaller clinics were opening up. The government itself has allowed more clinics to open up and take in more serious patients as well. So where are we? Again, using Mumbai as an illustration.
Yeah, over the past couple of months, definitely the bed strength in Mumbai has been augmented tremendously. So we have got enough of beds availability. But what we are finding is parallelly the number of cases are also going high very fast. So what we used to see about 10,000, 15,000, today we are talking about lakhs, whole of India, of which, if I'm not mistaken, almost one third is from Maharashtra. And of Maharashtra, almost, I would say, nearing 30-40% is from Mumbai, the numbers I'm talking about. So, yeah, we require a lot of beds. But what has happened is, over the months, we have also learned a lot about this virus. This was a new virus. We didn't know what had hit us about 6 months back. But we have also learned a lot about this virus. And today, a huge number of these patients, especially those who are mildly symptomatic or asymptomatic, they are undergoing what is known as home isolation and home quarantine. So majority of these patients we are seeing, especially because they are from these high rises and from this society, there is a facility in their house for them to be isolated, and that is what advantage they are taking. And we find these patients, unlike what we were seeing about 3 months back, any and every patient who was positive, may it be symptomatic or asymptomatic, was rushed to the hospital and he was admitted. So that is not happening now, at least in Mumbai. Plus, there are a lot of facilities which have opened where you can be in direct contact with your doctor or a healthcare worker, and you get the necessary treatment in your house itself. And they teach you how to monitor and when you should, immediately report to the doctor. So when we see all these things, definitely the bed strength as of today, we are quite comfortable. Only a little bit worrisome is the number of ICU beds, because as I said, when the numbers increase, almost 5% of them require ICU, of which almost 1% require ventilators. But when the numbers goes up in lakhs, so the number of even ICU beds goes up in hundreds and thousands. So that is a little bit of worrisome, and still we are fighting on that front. But overall, generally, we are almost about 20-25% of the beds are going empty today in all these huge facilities which have been put up by the corporation and the government.
Right, and that's an important point, that despite the cases going up, because they are in high rises, which of course exposes one let's say dichotomy, but it's also in a way a good thing, because the high rises have apartments where people can stay in, as opposed to visiting the hospitals and putting pressure on that system. So Dr. Kant, let me come back to you. So how are you seeing the evolution of this disease? So you, quite accurately pointed out that it's now 6 full months since our lockdown. Are you seeing any signs of which way it's going now that you're also saying it's spread more or less evenly across the system?
I think now, at least, I see three things that are taking place. One thing that's happening is that it is moving from the bigger metropolitan cities into smaller towns, cities, and moving into moving inside the country into hinterland, right? The other thing that's happening is that the states which were not reporting anything now are now moving up that ladder. Third thing, some states which had thought that they have been able to control it, the infection is coming back to those states in a big way. And I think these three things actually give the epidemic picture what it is today, that we are still on the ascending arm of the epidemic. We are still moving up. And because we have still a big chunk of our population which is not being exposed to virus, and these people will ultimately get infected unless we get an intervention, maybe an injection, vaccine comes around, that we are able to protect them, because they will not have any kind of an immunity by themselves. Therefore, it is important that we continue to press, testing, and continue to educate people that they must observe those interventions, putting up a mask, keeping distance, safe distance, and staying at home if you do not need to go out. I think it's very important. And now as it moves into those areas are the places where you don't have much access to expertise. Healthcare facilities may not be there. The doctors may not be there. The testing facilities may not be there. So these infections may just go unnoticed. And that's my main worry now, because it's now moving into rural areas of the country.
Right. And Dr. Utture, how are you seeing the trajectory within the city of Mumbai, specifically? So now, the data seems to suggest that if we look at containment zones, if we look at new cases, it's slowing down in the slums. But could that change? And if that changes, particularly if, let's say, we open up trains tomorrow, or there's a sudden increase in public transport, what happens then?
Well, all over the world, the second wave has started, majority of the places. And as Dr. Kant rightly pointed out, we are still ascending in the first wave itself. So we have not yet come. So maybe there will come a time where the first wave and the second wave will merge into each other, and we may just find these things. And that is, I think, what is the projection also, that in November, December, we may be seeing the highest number of cases coming in. This is expected once you start opening up. See, we have seen right in the beginning, we could control the number of cases because of the very strict lockdown which was placed. But then, India being India, You have to think from the economic aspect also. So the government had to take some decision, taking into consideration the pandemic on one side, and of course on the other side the economic health of the families, individuals. And majority of the families, as you know, we have lower middle class and the working class who are dependent on daily
Right.
wages. So they had to open up. There was no other way out for them. Now, once you open up, definitely in a crowded place like Mumbai, it is very difficult to keep safe distance from each other. So we are going to come in contact with each other, and this number of cases are definitely going to go up. But how I see it today is that in majority of the cases, unlike what we were seeing around 3 months back, even if they get infected, very rarely ever we find that they go in for gross symptoms and to get, as I said, to get admitted or anything. So somehow we are finding that the virulence is not that strong as we were seeing it before, or maybe our treatment facilities has improved. Definitely, as you know, we start antivirals immediately within the first 5 days. Then we give all other supportive treatments also. We have said maybe we are coming towards finding a treatment for this disease, but somehow luckily we are finding that it is not as bad a state as we were about 3-4 months back. But down the line, as I always tell everybody, that we should stop looking at the numbers. The only numbers that today we have to look at is as far as the deaths are concerned. If we can definitely get down the deaths, then we have done a lot and we have somehow conquered this disease. So stop looking at how many lakhs of numbers are going to be added to the figure, and look how many of them we can really save by putting in good health facilities. As Dr. Khan said, not only in the big metros, but even in the small areas, which unfortunately, because of the warped, governments over the decades, they have absolutely not looked after the health sector at all, with the abysmal
Right.
budget. And small towns and small villages have suffered because of that. So that has to improve.
Right. Okay. A last question to you, Dr. Kant. So, if you take a step back, 3-4 months ago, there was fear that, we will be swamped with cases, particularly in slums, because logically it seemed that, and they have no place to go and everyone is in very close proximity. There are public toilets, and that too in itself is a place where the virus could spread. So now that didn't happen. For various reasons, and the data obviously is showing that people, people are, have achieved some degree of immunity because they've already been infected. So, if you take a step back, what is this telling you in terms of the overall viral impact or the viral capability of coronavirus, and is that a source of, is that something we should feel good about? Or obviously, without saying that we have to become less cautious, but does it tell us something that we need not be so scared as we were perhaps much earlier?
Yeah, we need to be cautious. That is true. We cannot lower our guards at all. But as you said, and Dr. Uttre also pointed out, the mortality rate is coming down. People don't get as badly sick as they used to get in the month of March, April, and May, where the mortality rates were very high. Other thing is that the doctors have also, they have acquired those skills now. They feel better skill to manage cases, and also we have better interventions available. Those interventions weren't available, in the month of April, May, and June, when we were all very scared of mortality. And it also tells us that the people are developing some kind of an immunity. Whether that immunity would protect against the infection, or would it decrease the intensity of the infection, or would that be able to, whether it will be for 1 month, 3 months, or 4 months, that we do not know. But there is some kind of immunity that they're developing, and they may also be helping for the people not getting that severe form of the infection disease. So they may not require as many ICUs and all those things, ventilators and all, as we were needing it couple of months ago.
Right. So let's hope that's the case. The virulence, or I don't know if I'm using the right word, the viral impact is perhaps a little lower, and we are obviously seeing proportionately lesser serious cases, or we will continue to see. And the Mumbai illustration, where people can live in such tight proximity and yet not be exposed the way we thought they would, there is some sign of hope in that. So on that note, thank you, Dr. Kant and Dr. Ethiraj, and hope to meet you both soon.